Hollywood and fans across the country continue to mourn the loss of actor James Van Der Beek, the star known for his roles in Dawson's Creek, Varsity Blues, and several other projects you may have seen, passed away Wednesday. In 2024, he announced he'd been diagnosed with stage 3 colorectal cancer. Since then, he had been talking about his experiences with it publicly, sharing his story on social media. Van Der Beek just was 48 years old when he passed, and since then the news came out. Lots of questions have surfaced about colorectal cancer, what it is, how to look for it,
and the treatments as well. Today we have Dr. Dave Longcope with us. He is a colorectal surgeon with HCA HealthOne. Hopefully I got that correct.
HCA.
Yeah, thank you.
HCA. Yep.
Okay, thank you.
That's okay.
When we talk about this, somebody that's in their 40s, that's devastating news as it is, but I've been reading that colon cancer and colorectal cancers are up in younger people.
Yes, that's absolutely correct. In fact, it's really been going on since the 90s that
Really?
colorectal cancer has been increasing, but it's really just come to the forefront in the last decade that people have really started to pay attention to it. But yeah, it's increasing probably 2% a year in the incidence of colorectal cancer in younger people, which is people under the age of 50. So yeah, it's becoming a bigger and bigger issue.
Is it increasing because we're being more vigilant about testing for it? That's part of the question. And the other question is, if it is increasing, why aren't we testing at a younger age? Because what, it's 40, 45?
Yes.
And younger if you have a history?
Yes, absolutely right. So still the recommended screening age is 45, and that just increased recently, probably in the last 10 years.
Yeah.
There was a big push to get that from 50 down to 45 for that reason, because it's, we want to pick it up in younger people. But the answer isn't, I don't think the answer necessarily is just screen more people, because you're talking about a small percentage of the bigger population. So you'd have to do hundreds of thousands of colonoscopies to find, 5, 10 people with colorectal cancer, which is certainly important if you're one of those 10 people, right? But it becomes a cost issue and just compliance issue to get people in to screen. When we decrease the age from 50 to 45, those people in that age group that became eligible, you still don't get as many people coming for colonoscopies as they could. You ask about, is it just we're being more vigilant? We are looking for it more frequently, but again, people under 45, we're not looking in almost any of those. So it's not just that. The real question is, why is it increasing? And everyone's trying to figure that out, right? And so the real answer is probably multifactorial. It's not just one thing. It's not, the hot dog you ate at the fair 20 years ago that's causing it, right? It's genetics, it's our diet, it's our lifestyle. And it's also things that we're looking at as our gut biome, like what's the bacteria in our gut. We know that today, we have about 10% of the bacteria in our gut that our ancestors did 100 years ago. So we know that that's changing as well. So all of these things are playing into it, but it's not just one thing. And so we're really trying to figure out, and they're trying to do research to figure out how to decrease the younger people that are developing colorectal cancer.
Well, we don't have much time left, but I'm guessing you're going to say, if you know your family history, make some good decisions and don't be scared of getting a colonoscopy.
Yes, I think that's number one. Colonoscopy is still the gold standard, but also pay attention to your symptoms. If you're in your 30s, early 40s, and you have symptoms of bleeding, changes in your bowels, or you're having pain or weight loss, tell your doctor and get it checked out. Don't just take, you might have hemorrhoids and that's bleeding and that's why. We need to be more vigilant. I think everyone's starting to pay more attention. So
yeah, and it saved your life.
Yes, absolutely.
Well, thank you so much. Continue your good work
Thank
and
you.
keep spreading the news.
You bet. Thanks for having me on. You bet.